Hey everyone, welcome back to another medical coding CPC review. Today we're going over the eyes and the ears, and this is part of a playlist. So if this is the first video you're watching, you might want to head back to the main channel so you can watch all of the great videos that I have reviewing the different chapters for CPC preparation. If you're new to the channel, hi, I'm Victoria. I'm a medical coder, auditor, educator, and content creator, and on my channel, I provide tips, tricks, and tutorials to help you be successful in a medical coding career. If you haven't already, I would highly encourage you to subscribe and hit that notification bell so you can get alerts when I post new episodes. Now, let's get into the review. Hey everyone, welcome back to another medical coding CPC review. Today we're going to be going over the eyes and ears, so let's start into it. We're going to start with what is in the CPT sections for the eyes and ears. So we have our eyeball section. That's where we're going to start, just the general eyeball. So things like removal of the eye, where we have to pay attention to if it is with or without an implant, so an artificial eye then being replaced after we've removed the eyeball. After that, we have secondary implant procedures, removal of foreign bodies from the eyeball, and repair of laceration. Then we go into our anterior segment. And under the anterior segment, they have it chunked out between cornea, anterior chamber, anterior sclera, and the iris ciliary body, the lens, etc. So they kind of follow that same suit for most of them, the incision, removal, excision, etc. So cornea has excisions, removal, or destruction, and we have keratoplasty is a corneal transplant or a surgical procedure to replace part of your cornea with corneal tissue from a donor. And then we have other procedures. Under anterior chamber, we start with incision. That includes things like a goniotomy, which was when a doctor uses a gonioscope to examine the eye and possibly drain excess fluid. And then we get into our removal, introduction, anterior sclera, excision. We have the aqueous shunt. So the aqueous shunt insertion is an incisional procedure for treatment of the eye pressure, the intraocular pressure, and it's caused by glaucoma. Then we have repair or revision. Then we get into our iris ciliary body. Nothing unusual here. Incision, excision, repair, destruction. Then we get to our lens incision and removal. And then we have our intraocular lens procedures. And those are for the cataract extractions and insertion of that replacement lens. So then we have our other procedures, and then we get into our posterior segment, vitreous, retina or choroid, repair, prophylaxis, destruction, posterior sclera, repair, other procedures. Next of the eye, we have our procedures of the ocular adnexa. Extraocular muscles, that contains the strabismus surgery. So strabismus is when the eyes are crossed. And then we have those procedures there, the extraocular muscles, exploration, excision, decompression, other procedures, eyelids, so incision, excision, destruction. Tarsorrhaphy is a surgical procedure in which the eyelids are sutured together to protect the cornea. And then we have the repair, so that includes things like an eyebrow lift and an eyelid lift. Then we have retraction, ectropion, and entropion reconstruction, other procedures. Next to our conjunctiva, so incision and drainage of the conjunctiva, excision or destruction of conjunctiva, injection into conjunctivoplasty, other procedures, and then finally our lacrimal system, incision, excision, repair, probing and or related procedures of the lacrimal system, and then other procedures. Next, we get into our ears. So ears, we have here the external. We're going to start with external, then go into the middle ear, and then deeper into the inner ear. So that's how they order them, kind of the outside to the inside of the ear as they're sequenced in CPT. So our external ear, incision, excision, removal, repair, other procedures. That can even be things like patients who are having their ear lobes repaired sometimes. And then next in the sequence, again, I said it goes kind of from the external ear in the order of code sequence into the middle ear. So now we're in the middle ear, incision, excision, repair, and then other procedures. Then we get further into our inner ear, and then the inner ear, we have incision and destruction, excision, and then introduction. So that is actually our cochlear implant code, that 69930 there for the introduction. And then we have the other procedures. Then we have our temporal bone middle fascia approach. And actually included in this at the very, very end of the section 699990 is that operating room microscope code. And that kind of comes in right at the end there. They kind of throw it at the end almost of the ear section. And that is the code we talked about. It's bundled a lot into different other procedures if it's something that's routinely used with an operating room microscope, but if it's not always done with an operating room microscope, sometimes you can build that out separately with that code, the 69990. When we talk about our ICD-10-CM codes for the eyes, we have our cancers of the eyes, of course, so that our C69 through C72 would be malignant neoplasms of the eye, and then also included in there would be brains, other parts of central nervous system. And chapter 7 is actually our code for diseases of the eye and adnexa, and it's all kind of broken down based off of different parts of the eye. So we have disorders of the eyelid, the lacrimal system, and the orbit. Following that is disorders of conjunctiva, then sclera, cornea, iris, and ciliary body. Lens, disorders of choroid and retina, and then we have our H40 through H42 are all the different codes for glaucoma, and we'll talk about glaucoma. Disorders of the vitreous body and globe, optic nerve and visual pathways, followed by disorders of ocular muscles, binocular movement, accommodation and refraction, and then visual disturbances and blindness, other disorders of the eye and adnexa, and then H59 is our intraoperative and postoperative complications and disorders of eye and adnexa not elsewhere classified. Now, our ears are fairly straightforward chapter, and actually there aren't any chapter-specific guidelines for Chapter 8. So if you're trying to find the guidelines for Chapter 8 and you can't find them in your ICD-10-CM manual, it's because there aren't any chapter-specific guidelines for the diseases of the ear and mastoid process. It's a fairly short chapter. So we start with our H60 through H62, which is our diseases of the external ear, then our middle and mastoid, inner, and then other disorders of ear, and then our H95 is intraoperative and post-procedural complications and disorders of ear and mastoid process not elsewhere classified. So let's talk about a couple of the concepts that we do have in ICD-10-CM guidelines pertaining to our eye. So we have some different concepts as it applies to glaucoma. So with glaucoma, you might have a different type of glaucoma and a different stage of glaucoma in one eye versus the other. So you can assign as many codes from category H50 as you need to identify the type and the stage for each particular eye. The guidelines then go on to say that if the patient has bilateral glaucoma and each one is the exact same stage and the exact same type of glaucoma, there is a code for that bilateral of those if they have the same type and stage. However, if the type and stage does not match for both eyes, then you're going to need one code for the right and one code for the left. So you can't use the bilateral codes if they don't have the exact same type and stage for both eyes. There are also a couple of subcategories, so H40.10 and H40.20. Those do not provide a bilateral code, so you would only report that code once for that type of glaucoma with the appropriate 7th character for the stage and type. One procedure that I've had to explain the coding regulations for a lot in my career, because it comes up a lot in family practice, is the procedures for impacted cerumen removal of the ears. There used to just be one code, 69210, and that was for with instrumentation. And then a few years ago, they actually did develop a code that included just a lavage. Now, there's a couple similarities between both of these codes. So for both, either the lavage only, meaning the provider takes warm, sterile water and just warm flushes out your ear to try and dislodge that impacted earwax, or the instrumentation where maybe they take a cerumen spoon or some sort of instrumentation and try to scoop it out. In either of those procedures, the documentation has to support that the cerumen was impacted. If it does not state that word impacted cerumen, then it just gets incorporated into the appropriate E&M code. So if some of the criteria is not met, it might just be incorporated into an E&M. So let's look at this. So for the lavage, it has to state that it's impacted. It has to state that you used a lavage, you used warm water to try to flush out that earwax. Depending on peer preference, I've seen some that want an RTLT if you're doing right or left. And then with the 50 modifier, if you're doing both ears, some of them want 50, some of them want RTLT, some of them want you to bill 2 units, some of them want just 1 unit. So there's a huge variety that I've seen with both of these codes as far as payer preferences. And then if you're not meeting that criteria, if something was missing from that and you don't have it and can't get an addenda, that would just get incorporated into an E&M code. Now for the 69210, which is the removal of instrumentation, same thing, has to say it's impacted. It has to state there was instrumentation. It has to say what kind of instrument did you use that to try and dislodge that impacted cerumen, because that's part of the code description requiring instrumentation. If it was just that lavage only, then we're going to use our 69209 code. Same thing with the payer preference as far as the RTLT, 2 units, 1 unit, etc. And if the criteria is not met and we don't have, it wasn't a lavage only, we can't bill it as a lavage only either. Again, it gets encompassed into that E&M. The ears are organs that provide 2 main functions, hearing and balance. So oftentimes if a patient has trauma or crystals in their ear, it can cause things like vertigo, where those sensors in the ear are sending incorrect signals to the brain about where things are, and it can throw you off balance. And both the hearing and the balance depend on specialized receptors called hair cells. The eye is a sensory organ. It collects light from the visible world around us and it converts it into nerve impulses. So the optic nerve transmits these signals to the brain, which then forms an image that then provides us to see. So it collects the light, it translates it to the brain, and that's where we interpret it as sight and vision and images. So let's go through first an ICD-10-CM case. A 68-year-old patient is struggling with hearing the TV and is receiving complaints from her apartment complex due to loud volume settings. She visits her PCP and is scheduled for a hearing assessment. What ICD-10-CM code should be used? Is it A, H91.90, B, H6690, C, R94.120, and then D, H61.90. So one of the first things I'm going to look at here is, I'm thinking it's probably an H code, right? Because those were all of our codes for the ear. Now, what makes this case interesting is we're not seeing anywhere here, at least I'm not seeing, a definitive diagnosis, right? So it's a patient who's struggling with hearing, and that's basically what we've got here. They are having problems hearing, and it doesn't even say to us what ear, it just says struggling with hearing. So for this particular one, I think we would start maybe in our alphabetic index under the word loss, because she's losing some hearing. So we're going to go under our L's for loss. So under loss and then our indentation hearing, it says see also deafness. It actually doesn't give us any kind of like good unspecified code. So we're just going to go with what it says here to see also deafness. I scrolled through deafness and it doesn't have anything on here either about like an unspecified code. So we're going to look under H91.9 and see what it says. So here under H91.9, it says unspecified hearing loss, deafness, not otherwise specified, high frequency, low frequency. And then it basically says here unspecified hearing loss, unspecified ear or right, left, or bilateral. So it doesn't say here what side. I mean, we're maybe going to think bilateral, but it doesn't state it in the documentation. So we can't use bilateral since it doesn't state bilateral. It just states that the patient is not hearing correctly. They're struggling with their hearing. And we're going to go with our H91.9, and then we need our next character. So we're going to go with unspecified because we don't know which ear it is, and we can't assume that it's bilateral. So H91.90, and is that one of our options? Yep, it is. H91.90. Now, hopefully we'll get a more definitive diagnosis for this patient down the line, but in the absence of that, we just have to use the hearing loss. Next, we have a patient with left otosclerosis, has a left stapedectomy with foot plate, and a drill is utilized to create an opening in the thickened foot plate and place a prosthetic replacement. What CPT code should be utilized? All right, so thankfully we can see here this is a left, and we have that LT modifier there. So all of them are going to have the LT modifier, right? So that's good. We have our stapedectomy here. We used a foot plate, and a drill. So those are, I think, some of the key things I want to look at. So we have 4 different options here: 69662, 69637, 69660, and 69661. You can tell these are all pretty close to each other in the book. So our 69662 is right here. There's our 660. 637 is right over here. So we could just, for this type of question, look it right up in the book and kind of comb through some of these. So let's start with our 69662. 69662 revision of stapedectomy. It doesn't look like a revision. It looks like it was a new one, not a revision of. B is 69637. So this one here is part of it. So we need to get tympanoplasty with antrotomy and mastoidotomy and or tympanic membrane repair with ocular chain reconstruction. Yeah, that doesn't look like anything that we did in this procedure. So it's definitely not that. 69660. 69660 is a stapedectomy or stapediectomy with reestablishment of ocular continuity with or without the use of foreign material. And then 69661 is with the foot plate drill out. So we have the foot plate, we have the drill, and this is stapedectomy. So this 69661 appears to be the right one that we're looking for, and that one is our option D. So option D. And then we want to have our LT modifier to incorporate that is the left side. I've had some people ask lately about the RT-LT modifiers. They're struggling with them. One of the key things with RT-LTs is they should be organs or body parts that you have 2 of. So you have a right and a left eye, you have a right and a left kidney. You do not have a right or a left trunk. Trunk is one body part. Same thing with like your skull. You only have one skull. You don't have a right skull and a left skull. So usually the RT modifiers are more for things that you have a pair of. Next, while resurfacing his deck, a small wooden fragment entered into Nate's eye. His provider anesthetized the eye and examined the cornea under ultraviolet light with the use of a slit lamp. A small wound with a piece of embedded wood was identified and flushed, removed from the eye, and a suture was placed. So what am I going to take over here? I mean, I'm going to take out that they did an examination of the cornea with the use of the slit lamp. There was a foreign body, so we removed that foreign body, we flushed it, and we placed a suture. So this might be one where it might not be as straightforward with what terms we might have to look up in our index. So maybe start with foreign body removal, because that's what it looks like. They took that piece of wood, which is a foreign body, and removed it from the eye. That could be something we could look at. The examination I maybe wouldn't start with, because I'm thinking if they're removing a foreign body, they're going to have to examine it first, right? So that's probably included in that. I'm thinking, especially since our options are only 1 code, that we're not looking for 2 codes here, right? We're not looking for an exam and a removal of foreign body. We're looking for more of a removal of a foreign body, maybe with a placement of a suture from that cornea. So what can we do? We have 4 different code options: 65270, 65280, 65275, and 65273. Foreign body removed from the cornea, the use of a slit lamp. So we have option A is our 65270. 65270 is a repair of a laceration of the conjunctiva with or without non-perforating laceration of the sclera, direct closure. We did do a suture placement here, but I don't know that we are necessarily just doing a suture because we removed a foreign body too, and that code doesn't say anything about the foreign body. Next we have 65280, and I apologize because my CPT book got a little bit misprinted, so it might be hard to read. 65280 looks like it is for a repair of laceration of the cornea and or sclera perforating, not involving uveal tissue. But again, this doesn't say anything about the foreign body. 65275 is our option C. So 65275 is the laceration repair of the cornea, non-perforating, with or without removal of foreign body. So even if it did or did not have a removal of foreign body, which in this case it did, we still use this code, this 65275. So I like that one. That 23, well, that's our option D, is conjunctiva by mobilization or rearrangement with hospitalization. That, we're definitely looking here at option C. So option C is our 65275, and that is the repair with the suturing and with the foreign body removal. If you wanted to look this up in the index, you would go to cornea and then repair, wound, and non-perforating, and it would lead you to the same code. Last one, what CPT code is used for a myringotomy of the left ear with aspiration? So we have two options, 69610, 69650, 69700, and 69420. So with this one, we've got the myringotomy. It's of the left ear with aspiration. And of course, all of them have the LT modifier already, so we don't have to worry too much about does it or does it not need LT modifier, because all of our code selections are going to have that. I'm going to start this one out looking in the index. So if you look under myringotomy, it gives you codes 69420 and 69421. Now, if we look at our options that we have here, right, we have A, B, C, and D, and option D is included in these two codes. 69420 is in our option D. 69421 isn't any of our options. So I'm pretty sure it's going to be 69420, right? So there you go. There it is, 69420, myringotomy, including aspiration and or eustachian tube inflation. So in that case, we have option D is correct. I hope you enjoyed this review of the eyes and ears. Next, we're actually going over radiology, so get ready for that one. If you're excited for it, definitely let me know in the comments below. I will see you guys in the next video, and until then, just keep on coding on.